Happy and good evening, everyone. My name is Miranda Dolmanovic. I'm the CEO of the Ontario Personal Support Workers Association. Thank you for joining us for the OPSWA and HSCPOA Town Hall, our second of today. I am very pleased to introduce our panel that is joining us today. First is Trevor Lee. He is the CEO of the Health and Supportive Care Providers Oversight, or HSCPOA, as we well know them. And joining him is Deborah Cohen, the registration manager from HSCPOA. And of course, I have Mr. Ian De Silva, my chief operating officer, who is joining us here today as well. We do have some housekeeping notes, so please be aware that if the chat will remain closed until after both of our presentations, where we're very happy to take your questions and answer them accordingly. We also reserve the right to remove anyone from the chat if they are harassing or not behaving themselves. But overall, we're here to have a great time and have a great conversation and learn what we can about HSCPOA and, of course, the OPSWA. So HSCPOA, it's off to you guys. Take it away.
Great. Thank you so very much, Miranda. So good evening to everyone. Thank you for taking the time to attend this second OPSWA HSCPOA virtual town hall entitled Dispelling the Myths about HSCPOA. My name is Trevor Lee, and I'm the HSCPOA's Chief Executive Officer. Since assuming my role in June of last year, I've been continually impressed by the dedication of many in support of advancing HSCPOA's public protection mandate and impact. Our collaborative approach with Ontario's PSW system partners, including with OPSWA, will continue while we raise awareness about HSCPOA. We have built, and we will continue to build, a deep understanding of the vital role PSWs play in Ontario's healthcare system and the role the HSCPOA plays towards public trust for HSCPOA registered PSWs in Ontario. I'm joined on this virtual town hall with my colleagues from HSCPOA, and will be responding to questions, and my co-presenter, Deborah Cohen, Registrations Manager. Before we begin the town hall, we'd like to share HSCPOA's land acknowledgement. The Health and Supportive Care Providers Oversight Authority acknowledges, with respect, that there are at least 46 treaties and other agreements that cover the territory now called Ontario. We are grateful that we can work and live in these territories. We are thankful to the First Nations, Métis, and Inuit people who have cared for these territories since time immemorial and who have continued to contribute to the strength of Ontario and to all communities across the province. May we all live with the respect of this land and live in peace and friendship with all its diverse peoples. It's important for the public, Ontario's valued PSWs, and others to have a clear understanding that these separate organizations have different mandates, but we share a common focus on the importance of PSWs within Ontario's healthcare system. It will especially serve the public well for communications to be crystal clear so that they understand who HSCPOA registered PSWs are accountable to, where to go for information about HSCPOA registered PSWs or assistance, and for what services. Please reach out to us if there is any interest in the HSCPOA presenting or in holding a joint town hall for your organization. As an independent and unbiased regulator, we do not endorse or partner with a particular association. Our goal is to ensure accurate information is circulated about HSCPOA through as many communication opportunities as possible. It does take a village. HSCPOA's website has a speaker request form on its promotional page. If you go to hscpoa.com/promotion, you'll find it there. Our presentation content will cover the following: an overview of HSCPOA, registration pathways and some statistics for you to be aware of, what success looks like, and there will be time for questions at the end following OPSWA's presentation. We'll do our very best to address as many of your questions in the time that remains. And now for our first myth. Many PSWs have been asking, what's the difference between HSCPOA and OPSWA? Simply put, HSCPOA's mandate or purpose is public protection. OPSWA acts or advocates on behalf of PSWs. HSCPOA has developed an information sheet that outlines the differences between our two organizations and other information sheet to demonstrate that together we are stronger. Both HSCPOA and PSW associations like OPSWA have separate yet important roles to play in Ontario's healthcare system. We have a short video to provide an overview of HSCPOA and its regulatory framework.
The Health and Supportive Healthcare Providers Oversight Authority was created by the Government of Ontario to support public protection. As a PSW, by registering with HSCPOA, you demonstrate to your employers and care recipients that you will deliver safe, quality care. Your registration with HSCPOA now helps shape the future direction of PSW regulation in Ontario. HSCPOA's role is to register qualified PSWs and hold them accountable for providing safe, quality, ethical care to Ontarians in their homes, hospitals, long-term care and retirement facilities, or other environments. Our work includes establishing consistency in education and skills-based requirements, maintaining an online public register for access to information about Ontario's HSCPOA registered PSWs, ensuring registered PSWs adhere to HSCPOA's Code of Ethics, addressing complaints through a fair and transparent process, and overseeing disciplinary action, all while authorizing qualified and registered PSWs to use the HSCPOA PSW visual mark, which enhances trust in the work that registered PSWs do. HSCPOA's oversight inspires public confidence that registered PSWs will deliver safe, competent, ethical, quality care in Ontario. To learn more, visit hscpoa.com/public.
Great, thanks. Now on to our next myth. HSCPOA is more than a registry. It's an oversight regulatory body that, like other health regulatory bodies in Ontario, like the College of Nurses of Ontario, College of Dietitians, College of Physiotherapists, HSCPOA is aware that there are two previous attempts in Ontario to create registries for PSWs. HSCPOA is the difference, significant difference between the previous registries and HSCPOA is that there's overarching legislation now in place through the HSCPOA Act 2021. HSCPOA has the regulatory framework that previous registries were not provided to regulate, oversee, and hold PSWs accountable in the interest of public protection. The Health and Supportive Care Providers Oversight Authority Act of 2021 was implemented by the Ontario government. HSCPOA's legislation is similar, yet somewhat different from other health regulatory colleges in Ontario under the Regulated Health Professions Act. The legislation gives HSCPOA its marching orders in what we are required to do as an oversight body. You can view the HSCPOA Act and the regulations under that Act by going to the Government of Ontario's e-laws site and searching for HSCPOA under the browser for ontario.ca/laws. As you saw from the video, the overarching mandate of HSCPOA is public protection. HSCPOA will oversee registered PSWs to ensure delivery of safe, quality, ethical, and accountable care. Another myth. HSCPOA values and wants the input of the PSW sector to carry out our work. The Ministry of Health is taking an innovative approach that differs from the self-regulation model we see with other regulated health professions in Ontario. A regulation under the HSCPOA Act requires a PSW advisory committee that provides input and advice to the board and CEO from the PSW sector in Ontario. The committee is made up of HSCPOA PSW registrants in a variety of settings: employers, educators, associations, union reps, and recipients of care and families. And now I'll turn it over to Deborah for covering the voluntary registration.
Okay. Thank you so much, Trevor. Okay. So as I'm sure you've heard, registration with HSCPOA is currently voluntary for PSWs in Ontario. So that means that PSWs can continue to work in their roles without registration unless their employer requires a PSW employee to be registered with HSCPOA. The Ministry of Health was very deliberate in their decision to initially begin with a voluntary approach to registration so that there weren't any unintended consequences in the healthcare system in Ontario and the PSW supply in the province. In the future, HSCPOA anticipates that PSW registration with HSCPOA will be mandatory, and this decision will be made by the Ministry of Health. So it's not a HSCPOA decision, but rather the Ministry of Health's decision. At this time, we're unsure when that decision will be made, but as soon as we hear, we will certainly be communicating broadly within the PSW sector. We are hearing more and more that the PSW sector in Ontario does want regulation and oversight of PSWs, including from PSWs themselves, employers, educators, and so on. So there's still value in a voluntary approach. There are currently no fees to apply and become registered with HSCPOA, as the Ministry of Health is funding HSCPOA's work. The Health and Supportive Care Providers Oversight Authority has the ability to oversee other healthcare providers based on the Ministry of Health's decision. So at this point in time, we are not sure if and when any additional providers will be added. But again, if the ministry makes such a decision, we will certainly let or communicate that decision broadly. So we have another myth about the benefits to registration. So there are many benefits to becoming a registered PSW with HSCPOA. And so we'll cover some of these in the next couple of slides. So certainly there's trust and respect. So a PSW has met the requirements for registration and that they're committed to safe, ethical, and competent care. There's also demonstrated accountability for registrants because they are held accountable for safe care once they are registered. Registered PSWs stand out as committed to safe, quality, ethical care. In some cases, there are added employment opportunities for HSCPOA registered PSWs because more and more employers are either making it mandatory for their PSW employees to be registered with HSCPOA or strongly encouraging this. HSCPOA PSW registrants have the ability to use the PSW visual mark to identify that they are registered with HSCPOA and held accountable for safe care. And as I mentioned previously, it's free and voluntary. So I'm going to cover the registration pathways in the next section. And before we get to that, we just wanted to mention that quality care is the cornerstone of Ontario's healthcare system, and that PSWs play a very critical and vital role in that. So we have a short video, again, to show you about the registration pathways, and it also covers some of the benefits to registration as well. So I'll share that, and then we will dig a little deeper into the registration pathways.
Are you a personal support worker in Ontario? You can apply for registration with HSCPOA, the new oversight body for registered PSWs in Ontario. Why register with HSCPOA? Trust, respect, and accountability. By registering, you demonstrate to employers and care recipients that you will deliver safe, quality care. And your registration with HSCPOA now helps shape the future direction of PSW regulation. Plus, you'll earn the right to use the HSCPOA PSW visual mark, a symbol of your dedication to safe and ethical care. Join other PSWs who take pride in being regulated and are recognized as trusted health and supportive care providers. The easy online application process guides you every step of the way. Whether you've completed Ontario PSW education, gained skills through work experience, or moved from another province or country, there is a registration pathway for you. Path 1. If you've completed a PSW education program that meets the Ontario Ministry of Colleges and Universities requirements on or after July 1st, 2014, submit your certificate or diploma and transcript. Path 2. If you've worked as a PSW in Ontario in the last 3 years, provide employment confirmation and proof of hours worked, or a combination of employment confirmation and PSW training. Path 3. If you're currently registered on a healthcare aide or continuing care assistant registry in another Canadian province, transfer your credentials with a letter of standing. Path 4. Competency assessment. This is for applicants with no Ontario PSW work experience within the past 3 years who obtained their education abroad or in Canada outside Ontario and not currently on a Canadian personal care registry. No matter your registration pathway, you'll also submit your ID, proof of language proficiency if required, and a criminal record check. Currently, there's no cost to apply. HSCPOA registration is voluntary and free. Registering with HSCPOA helps you stand out and build trust with employers and those you care for. To learn more, visit hscpoa.com/applicants.
So if someone wanted to learn more about the application pathways, they can go to hscpoa.com and select Apply Now from the homepage banner. And there's also the ability to view the pathways in the applicants section or the top blue tab. If you are ready to apply for registration, you can go to the top right-hand section of our HSCPOA website and select PSW login and follow the instructions for setting up your application profile. All applicants, before they become a registrant, demonstrate certain requirements. So either the applicant is demonstrating that they have the recognized PSW education, or a combination of education and experience, or experience alone. There's a language proficiency requirement, and most applicants are demonstrating that language proficiency through the completion of their education program in English or French. There's a good character requirement, which is demonstrated through a criminal record check, declarations and attestations on the application form, and, if applicable, letters of good standing from other regulatory bodies that they may have or are currently registered with. So we have another myth here regarding our criminal record checks. So HSCPOA accepts the following types of criminal record checks: a criminal record and judicial matters check, CRJM for short, and this is sometimes called an enhanced or a level 2 check. We also accept vulnerable sector checks. OPSWA uses the CRJM check in their for members, so HSCPOA will accept those criminal record checks from OPSWA members if the criminal record check is valid. And valid means that the check was completed within 12 months of the date of application to HSCPOA. So if someone has a valid criminal record check, they then upload that in their application portal. If someone needs an updated criminal record check, then they can complete one at their local police station or other source, or we have an option through the HSCPOA application form for applicants to undergo a criminal record check. In the application form, an applicant consents to undergoing the check, and an email will follow, and then the applicant clicks Get Started within that email, and they follow the instructions on completing the criminal record check. The criminal record check is through HSCPOA's application does cost $23.60. So this is a potential fee that an applicant may need to pay. However, this fee is far lower than we are aware of from other sources, including local police stations. And so we really try to keep this fee as low as possible in negotiations with our vendor partner for the criminal record check provider. And we wanted to ensure that there weren't barriers on applicants applying for registration. So as you saw from the video, there were the 4 main pathways to registration that are outlined in our registration regulation under the HSCPOA Act. We also have a recognition of nurses and midwives policy. And this policy was put in place because we know that there are many internationally educated and even Canadian trained nurses who do work as PSWs in Ontario. And so we wanted to make sure that these individuals had a way to become registered with HSCPOA if they wished to do so or needed to do so because their employer requires it. Certainly, it's our hope that these individuals are working to their full scope, and perhaps they're looking to or in the process of registering with the College of Nurses of Ontario or College of Midwives of Ontario, as the case may be. And so that's something that, of course, we're mindful of. So we know that there are many questions about path 2. And so we'll cover a little bit more about Path 2 in the next few slides. So our next myth is about the requirements for those who are educated before July 1st, 2014, and that they have to go back to school. So we want to just explain why this myth is untrue. Now, Path 2, employed as a PSW in Ontario, is our legacy pathway. And so this is the Ministry of Health put this pathway in place to value and recognize the contributions that PSWs were making in the healthcare system. So if a PSW is employed or has been employed in the past 3 years as a PSW or equivalent in Ontario, then there are 2 options under this pathway. The first one is trained on the job exclusively. So this is a PSW who has learned their skills on the job and perhaps worked for decades in some cases as a PSW and are very highly skilled and competent. There's also the option for Path 2B, and that includes those PSWs that were educated before July 1st, 2014. So they're not eligible through Path 1, and they have completed their education before July 1st, 2014. So these individuals may not necessarily have worked 600 hours or more, but they have employment in the past 3 years, and they have completed previous education. Now, Path 2 is a time-sensitive pathway, meaning that in our regulation, it will close on December 1st, 2027. And it's very common for new regulatory bodies to have these legacy pathways in place that do end up closing or are time limited. Under Path 2, an applicant submits an employer form that was completed by their employer, and the employer confirms skills of the PSW and confirms employment. The employer must be on what's called the prescribed category, or fall under the prescribed categories in our registration regulation. And this includes many of the PSW employer groups in Ontario, such as hospitals, long-term care homes, home and community health services, etc. And the list of employers, the prescribed employers, was developed by the Ministry of Health to ensure that there was someone who could actually confirm or attest to the PSW's skills and competence, and that it wasn't, a friend or a family member or a self-declaration under this pathway. We are aware that there are some challenges regarding some staffing agencies who may not fall under a prescribed employer category. And so we are actually working with the Ministry of Health to try to remedy that and come up with some solutions so that as many PSWs can become registered with HSCPOA. So after December 1st, 2027, the Path 2 will close. So it's important to note that anyone eligible through Path 2 must become registered and remain registered by December 1st or before this Path 2 closes. There are also some impacts on the Fixing Long-Term Care Act and HSCPOA, in particular Path 2, that we wanted to help clarify information for those that may work in long-term care settings. So under the Fixing Long-Term Care Act, there is a regulation, and this regulation has a section, it's Section 52, that outlines the qualifications for PSWs to work in licensed long-term care homes in Ontario. And what the qualifications include are that a PSW is either registered with HSCPOA or they are eligible for registration with HSCPOA. And there are a few limited exceptions like nurses and nursing students, etc. So for PSWs working in long-term care settings, if you are only eligible through Path 2 to register with HSCPOA, then again, you must register and remain registered by December 1st of 2027. If you do not become registered, then that means that you're no longer eligible for registration with HSCPOA, so you don't meet the regulations requirements under the Fixing Long-Term Care Act. And that at that point in time, that's when you may need to go back to school in order to remain eligible for registration with HSCPOA and remain under the qualifications for employment in a long-term care setting. So currently, you don't have to go back to school, just to reiterate that. Most PSWs, especially those working in long-term care, will be eligible for registration through Path 2 until December 1st, 27, or in some cases, if you completed your education after July 1st, 2014, then eligible through Path 1. So many of you may be wondering the registration stats to date for HSCPOA. So how many PSWs have voluntarily registered with HSCPOA? So we ran the numbers this morning, and we have 9,200, so just over 9,200 PSWs who are registered in Ontario. And the majority of our registrants have come through Path 1, the Ontario PSW education. We have then followed by the Employed as a PSW in Ontario group, and to a lesser extent, our recognition of nurses, our labor mobility applicants, and our competency assessment applicants. Registration stats for those registrants in where they work is shown here on this slide. So we have the majority coming from the long-term care and the home and community care sector, followed by hospitals, and then to a lesser extent, our staffing agencies and retirement homes. And, we just wanted to mention that this is self-reported data. So all of our applicants and then subsequently as registrants do indicate where they currently work if they are employed as a PSW, and do have an obligation to keep their employment information up to date. So moving on to our next myth. So once you're registered, that's it. And we wanted to clarify that once you are a PSW registered with HSCPOA, that you do have additional responsibilities to demonstrate your accountability. So registrants must follow the expectations that are outlined in HSCPOA's Code of Ethics. And the Code of Ethics outlines the requirements for PSWs to demonstrate safe, ethical, and quality care. As I mentioned, that all PSWs do have to keep their information up to date, including their contact details, so that we can connect with you as need be, and also your employment information. There are some mandatory reporting obligations that PSW registrants need to fulfill as well. One of the big responsibilities for PSWs each year is to renew their registration. So renewal opens February 1st each year, and we are actually going to complete our first annual renewal by March 31st, 2026. So we began registering our PSW registrants once the regulations under the HSCPOA Act took effect on December 1st, 2024. And so we actually are undergoing our first renewal period this year. There are currently no fees to renew your registration. What will happen once you renew your registration each year is that your certificate of registration will be issued from April 1st until March 31st each year. For this year, all of the certificates of registration for those eligible to renew will, they expire on April the 1st of 2026. So when you become a registrant, you're actually issued a certificate of registration, and it will say that it expires March 31st of 2026. And so that certificate expires unless you renew into the next registration year. Now, renewal is not a very onerous or very time-consuming process. It's quite quick and easy, and it includes updating your information and completing questions that we are required to ask of our registrants. And one of the reasons why we ask these questions is for HSCPOA to report annually to the Ministry of Health for their health professions database. And so data is reported annually by HSCPOA and also similarly by other health regulatory colleges in Ontario. And this data is all provided in an anonymous combined format to the Ministry of Health for their health and human resource planning. There is no criminal record check requirement for annual renewal each year. So as you heard earlier, a criminal record check is required at application only, and so it's not required each year that you renew. In the future, it is we're still working out the process for continuing education or continuing quality improvement, because our continuous quality improvement regulation is still waiting for Ministry of Health approval. And once that regulation is passed by the Ministry of Health, we will be developing our continuous quality improvement or continuing education program at HSCPOA. And that will be developed in consultation with many system partners, including PSWs themselves. So all PSW registrants who are required to renew their registration will be informed by February 1st of 2026, and then again in following years, February 1st, 2027, etc. There are 3 key reasons why registrants need to renew annually. And the first one is transparency, because as required in law, HSCPOA must have an accurate and searchable public register on our website. Most of the information in the public register is collected on the application form and at annual renewal. And we also need to maintain this accurate public register because this is something that people are using to find out current registration information about our registrants. And this requirement to maintain an accurate public register and certainly to maintain your information with HSCPOA is outlined in the Code of Ethics, which it requires registrants to update their information within 30 days of any changes. We also have reporting requirements that we submit annually to the Ministry of Health. And so these questions on renewal, as I mentioned, do help provide that data for us to report accordingly. So what happens if a PSW registrant with HSCPOA doesn't renew their registration? So your registration with HSCPOA will automatically expire by the March 31st deadline date each year if you don't renew into the next year. A status of inactive will be displayed on the public register of PSWs under your profile. And your registration history on the public register will also show that your registration has expired, and that shows up indefinitely. So we want you to not risk your PSW employment opportunities and ensure that you do renew early, because more and more HSCPOA is learning about employers that are making it mandatory for their PSW employees to become registered with HSCPOA, or highly encouraging this. So we really want to ensure that you have the best employment opportunities available to you. So I'm now going to pass it back over to Trevor to cover the next section.
Great, thank you, Deborah. So it's anticipated that most HSCPOA registered PSWs will provide safe care that aligns with HSCPOA's Code of Ethics. Where concerns arise, a complaint can be made about a HSCPOA PSW registrant. Every complaint is reviewed in the interest of public protection. Registrants receive a copy of the complaint and have an opportunity to respond before decisions are made. Remedial approach is always preferred through education and training. No regulator takes pleasure in taking away licenses or, in our case, registrant status unless there are extreme circumstances of risk to the public. Written decisions and reasons letters are sent to the complainant and registrant. Certain outcomes, written warnings, orders for education or training, registrant undertakings, interim orders, or referrals to the discipline committee are posted on the public register in alignment with the requirements in the register regulation under the HSCPOA Act. There are mechanisms to appeal the outcomes of HSCPOA's complaints and disciplinary processes. Above all, HSCPOA's complaints process helps improve trust in the care that PSWs provide. Since there is a mechanism to address concerns, processes are transparent, and PSW registrants will be treated fairly throughout. Public protection. HSCPOA fulfills its mandate of public protection by ensuring registered PSWs provide safe, quality, ethical care. HSCPOA is committed to fair and transparent processes in all the work using right touch regulation. We will work within our legislative authority and organizational policies so that all PSWs in Ontario become registered with HSCPOA. PSW registrants understand what it means to be regulated, including completion of annual renewal and future continuous quality improvement. We will implement a PSW advisory program to provide support and resources to HSCPOA registered PSWs to meet these obligations. The overarching goal that PSWs are trusted, accountable, and valued members of Ontario's healthcare system, which is good for everyone. We have a call to action for PSWs. Become registered, help inspire others, and raise awareness. Convey the benefits of PSW registration with HSCPOA. Share HSCPOA's resources and promotional content, information sheets, FAQs, guides, and videos. Follow us on social media and share videos via YouTube and posts published on Facebook and LinkedIn. So thank you. Please feel free to connect with us via email with any questions. You can also refer to our website content for additional promotional information. If you haven't already done so, subscribe to HSCPOA's news to receive timely information. Visit HSCPOA.com and scroll to the bottom of our homepage to sign up for our newsletter or scan the QR code on this particular slide. All PSWs registered with HSCPOA receive our newsletter. Also follow us on social media platforms like Facebook, LinkedIn, and YouTube. And we will be having some questions at the end of this presentation, and I'd like to turn it over to Miranda, and now we'll move into the OPSWA section of our town hall. Over to you, Miranda.
Thanks so much, Trevor, and thank you, Deborah, as well, for a wonderful presentation to the PSWs. I think it was very informative, and I look forward to what's going to happen in the future. So thanks, everyone. As we said before, my name is Miranda Romanovich. I'm the CEO of the Ontario PSW Association. I'm joined by Ian De Silva, my COO. We are the Ontario Personal Support Workers Association, as many of you guys are well aware, and we are your professional association here in the province of Ontario. So what is a professional association? A professional association is a membership-based group formed by individuals in the same or similar occupations to advance their career field and protect the interests of those working within it. For those of you who do not know, I am a proud personal support worker. I'm actually celebrating my 20th year as a PSW this June of 2026, and I formed this association with a handful of other personal support workers who were as passionate as me in this area.
So professional associations continued. One of the key elements of a professional association is advancing the profession. Professional associations promote the value of the industry to the public. We lobby governments for favorable policies or legislation. Member support. We provide resources to help individuals succeed, such as job boards, salary surveys, and legal advice, of course. Standard setting. Professional associations establish best practice guidelines and offer continuous professional development opportunities for their members. And professional associations invest in understanding the regulatory oversight and are committed to keeping their membership aware of timely developments, which is why we're here this evening.
So why is it important for PSWs to have a professional association, which is a question that we used to get all the time, is professional networking. So you connect with thousands of PSWs across Ontario. We are the largest community of PSWs actually across Canada, including peers, mentors, educators, and employers, to build meaningful relationships that support your career growth and professional confidence. You know, if only a PSW understands a PSW, we find, and many times that's how they get their answers, the answers to many of their questions. Continuing education and skill development. So you gain access to OPSWA approved training, continuing education units, workshops, webinars, and exclusive professional development opportunities designed specifically for PSWs. So the OPSWA actually has some really great programs and courses, micro-credentialing that we have out right now, like autism training, specialization in autism, de-escalation, fire safety, and mental health. And these are all geared specifically to the personal support workers.
Continuing on, career advancement opportunities. Members access job posting sites, and we have access to employer partnerships and leadership opportunities through OPSWA committees, advisory groups, and special projects to strengthen your resume and professional profile. Very important to make sure you get as much different experience for your resume as possible. Professional recognition and credibility. OPSWA memberships demonstrates professionalism, accountability, and commitment to the PSW profession. Being a verified OPSWA member, OPSWA member, helps you stand out to employers, recruiters, and healthcare organizations across Ontario.
Yeah. So again, do other professions in healthcare have professional associations? Yes, just like other professions have regulatory bodies, governing bodies. So like here in Ontario, the registered nurses, they fall underneath the College of Nurses, but they also have the Registered Nurses Association of Ontario, the RNAO. We RPN for the RPNs. Physicians have the Ontario Medical Association. Nurse practitioners have the Nurse Practitioners Association of Ontario. And of course, PSWs have OPSWA.
So what does OPSWA offer its members? So our OPSWA memberships include your annual criminal background check, which is included in the membership cost. All members get 2 million professional liability insurance with 50,000 abuse coverage. This is the important one. Access to PSW specialization and advanced training programs. This is going to become more important as we go forward with this profession. Exclusive course discounts, career guidance, job resources, and workplace advocacy. This is an important one. Discounts on preferred pricing on retail, insurance, and partner services. Official OPSWA OPSWA photo ID badge, verified professional identification.
We can't forget about the badge, Ian.
The badge, here we
The
are.
PSWs love the OPSWA badge.
Absolutely.
This badge, of course, is now also going to be made available to our student members moving forward as of March 1st. So that's also exciting for our student members.
That's excellent.
So how do HSCPOA and OPSWA work together? So HSCPOA is the oversight body for PSW registrants with a focus on public protection. We like to say that HSCPOA protects the public and OPSWA protects the PSW. So PSWs are registered with HSCPOA. You guys are accountable for the delivery of safe, quality, and ethical care. And OPSWA represents the voice of the PSW by sharing frontline experience, advocating for fair working conditions, and ensuring PSW care guidelines reflect real-world practice. And together we share a common focus on the importance of valued PSWs within Ontario's healthcare system.
Collaboration helps to ensure accurate and consistent messaging about the HSCPOA, the oversight body for PSWs in Ontario. This collaborative effort contributes to better care outcomes, stronger sector accountability, and a more sustainable future for PSWs in Ontario. OPSWA will be kept informed about HSCPOA's activities to assist our members to understand how PSW regulation impacts them.
Important.
Very much so.
And that is questions for us. So now I guess we're going to open up the floor, for lack of better terms, to PSWs to ask their questions in the Q&A. And of course, go into the chat and ask your questions. We're going to be taking your questions for the next 15 minutes. So take it away. Does anyone have any questions for the HSCPOA team?
There's one in the chat right now. Do you want me to read it out?
In the chat? No, it's in the Q&A. I think Deborah is typing an answer.
Okay.
There you go.
I can verbally respond to the if easier. Do you want me to do that?
Well, I'm just going to read the question out, so I'm not sure if
Sure. Yeah, great. Thanks.
If a PSW takes an NACC exam, why do they have to register under a pathway? There are courses through colleges that are accredited, and the 600 hours meet the MHLTC, sorry, acronyms. Excellent question, Patty. Thank you. Deborah, I'm sure you got this answer.
Yeah. So anyone that completes a program that is under NAC does do the NAC exam. And so we recognize completion of those PSW education programs through Path 1 if they're completed on or after July 1st, 2014, or Path 2 if completed before July 1st, 2014. Now, completion of the education is just one aspect of a PSW's process. We are actually the oversight body. And so what that means is that someone would be eligible for registration and that they are then held accountable for safe, quality, and ethical care with HSCPOA as the oversight body. So it's kind of very similar to some of the other health regulatory bodies that you may be familiar with, like the College of Nurses. So a nurse completes their education as a nurse, and then they become registered with the College of Nurses through the registration process. So I hope that helps.
There's actually another great question here, Deborah, that maybe you guys can answer. Do you anticipate, and I think Ian just got rid of it.
My apologies. I'm so sorry. I'll read it.
Do you anticipate further education for PSWs in the future that would broaden their scope, for example, medications and administration, now that they are regulated?
Yeah, I mean, I certainly, Ian had responded from OPSWA's perspective. So from HSCPOA's perspective, it's certainly possible that there may be a defined scope of practice for PSWs. There's not one in the legislation right now because most of what a PSW does is in the public domain. Now, we do recognize that in some cases where it is in the recipients of cares or the client's best interest, there may be PSWs who are performing full or partial controlled acts when they have the skills and competence to do so, and that when there is the appropriate authority mechanisms in place. So time will tell based on Ministry of Health decision making whether or not there would be any changes or any defined scope of practice specifically for PSWs in Ontario.
Thank you, Deborah. I think that's a great answer. We don't know everything yet. It's just the beginning, and all we can do is just, move forward and move upwards. The PSW is evolving, which I think is fantastic. Do we have any other questions, Ian?
I am a seasoned PSW from 2007 from Niagara College, and I'm not working at present. How will this affect me in regards to registering with you? Will my PSW certification be null and void? So this is a little bit more of a gray area, Deborah. I'm not sure if you can answer that.
Yeah, I'm just reading that. Okay. So your registration is, your education is not null and void. So once the Path 2 closes, then there may be some restrictions in your registration ability. But up until December 1st, 2027, what you can do is become employed as a PSW in Ontario, and then you would be eligible for registration with HSCPOA. Now, note that you don't have to have worked 600 hours if you become employed before Path 2 closes because you have the previous education.
The other question, thank you so much, Deborah, appreciate that. The other question is, can and how does a privately employed PSW join the HSCPOA?
So if they are educated on or after July 1st, 2014, they can come in through Path 1. But under Path 2, this is a limitation that we have identified to date, and there isn't a means for those individuals to become registered at this point in time because a PSW can't sign off on their own set of skills, and certainly a family or a friend can't do that for them. So we are working with the Ministry of Health right now to try to solve that issue for these PSWs. And so we will be sure to communicate what that solution is well in advance of the closure of Path 2.
Great, thank you so much. We have a question regarding compatibility with unions. Why should a unionized person feel that they should be a part of either associations? And Randy, why don't you jump in for that and we'll let HSCPOA go after. So for us,
no problem. So yeah, I mean, we have a lot of unionized PSWs that are members of the professional association. Your union is important to you in your workplace. They are there to deal with grievances and bargaining agreements to ensure that you have fair working environments. But the association, we like to say, actually takes care of the entire PSW. So that's why you guys get a $2 million professional liability insurance, which is medical malpractice insurance, just like the doctors have, just like the nurses have, as well as yearly criminal record checks, an ID badge that identifies you as a PSW, plus all the discounts and everything else that OPSWA does. It's important that you take care of yourself, especially no matter where you are. So, I mean, a lot of PSWs don't just work one job, you work more than one job. So, you need to make sure that you have that insurance that follows you to every single employment so that you are safe. But I'll let HSCPOA take it.
Trevor, do you want to answer that question or would you like me to?
No, you can.
Yeah, so there are lots of benefits for unionized employees to become registered with HSCPOA, because what that does is it demonstrates your ability or demonstrates your commitment to safe, ethical, and competent care. And so, you should be proud of that. You've worked hard to complete your education and certainly have, in many cases, have many years of experience as a PSW under your belt. And so you are committed to safe care. And so registration with HSCPOA demonstrates that.
Thank you so much.
Well
There's a
said.
question here. There's one on from Ms. Maxwell. Did you want me to ask it or?
Go ahead.
So a question from Ms. Maxwell, a volume of employer organizations that have supported PSW for the 9,000 questions. So can you expand about the primary employers that have been reaching out to you more than others? Who's been your biggest draw? I know you had a chart earlier.
Yeah, I can certainly share my screen again, and then that might be helpful. So going back to the stats that we covered earlier in the presentation, there it is. So we have approximately 2,300 PSWs who have been registered under the employer or Path 2. And so all of these PSWs had to have their employer complete the employer form. So there's great support amongst the employers. Excuse me. What we also have in place is an employer directory that helps employers verify in a bit more of an efficient way who's registered with HSCPOA and compare that with their full employee list. In addition, we have a streamlined process to make it easier on employers who have high volumes of PSW employees registering through Path 2. And rather than complete the form individually for each employee, they can provide us with a list of their employees eligible under Path 2, and we cross-reference that list with all of the applicants that we receive and confirm through that way. And all information about our applicants and registrants is kept highly private and confidential through very secure mechanisms and database.
Wonderful. Thank you so much, Deborah. There's a question I meant to answer a question live, but I actually hit it. So I'm not sure if I understand this. What is the HSCPOA orientation to registered PSW care in Ontario course? What is the pathway applied? I think the question is, if you did a registered PSW care course in Ontario, which pathway is the one you go through?
Yeah, I can clarify this. So we have recently developed an orientation to registered PSW care in Ontario course. And this course is for those that have no work experience as a PSW in Ontario and are mainly coming through our competency assessment pathway. And so we want to make sure that you are set up for success if you are just beginning your career as a PSW in Ontario, because you were trained elsewhere, maybe another province or even another country for that matter, and you're coming in through our competency assessment process. This course is an online set of modules that just kind of orients somebody to what's it like to be a PSW in Ontario. Most of the people who are working in Ontario already know that, and certainly those that have been educated as a PSW in Ontario would have experience and know what it's like to work as a PSW through all of their placements and education. So those applicants are not required to complete that course.
Thank you so much.
We have some great questions happening in the chat right now, and I have no idea which one I want to pick first. So I'm just going to fire them off and you guys can answer them. So one of the quick ones here is, I'm working as a PSW in community settings. Am I eligible to apply for HSCPOA?
Absolutely.
Yep.
So it depends on the circumstances. Were you educated before July 1st, 2014 or after, educated on or learned on the job? You may be eligible through Path 1 or Path 2. And in some cases, if it is path 2, then you would have your employer complete the form. If you're privately employed, then that is something, as I mentioned previously, that we're working out with the ministry to address that gap, and we'll communicate that solution when it's made available.
Perfect. I got another really good one. Says in the educational sector, students, both PSW and nursing, are now expected to have police checks that are valid within 6 months of their start date. Did employers on your PAC have any input on you not requiring any updated police checks, or is it considered something within the employer's domain?
So we wanted to reduce barriers as much as possible, at least initially, on applicants seeking registration with HSCPOA. So we consulted with our legal counsel and we had put a plan in place for 12 months validity date for the criminal record checks. Now, once someone is registered, one of the accountabilities that they have is to report any instances of offenses and criminal charges and things like that under the Code of Ethics. And so once someone is registered, they are held accountable for that. And so they would make that report to HSCPOA, just like they would likely to their employer. So in most cases, you know, if an employer requires more frequent checks, then that's great. But HSCPOA is requiring the criminal record check upon application, and then a requirement to declare any incidents that may come up, you know, for changes to their criminal status throughout their registration with HSCPOA.
I see one in here as well. Thank you for organizing. That's great. We're glad that this service to our PSWs. Some hospital jobs postings specify a preference for PSWs trained at CAAT colleges only. Just to address this, HSCPOA is providing information consistently and at the same level across all of the employers, but let's not also overlook that employers can choose what they want to do with their recruitment practices or their advertising for position practices. We have no ability to influence that, but we certainly are available to educate all employers on what is the virtues and values of the HSCPOA registrant status as a benchmark of identifying the registry and oversight authority for PSWs in Ontario. So a couple of moments during the answers that we've had, I also wanted to weave this one in. We are here to talk to employers about making sure that they're aware and accurately aware of everything that we can do to help them understand their workforce and how to support their workforce's registration with HSCPOA. So it's unique by employers, but it's really up to them for their choices. But we certainly want to make sure that HSCPOA is the standard for identifying a registrant in working as a PSW in Ontario.
Mm-hmm. Okay. And if I could just add to that, Trevor, the registration regulation that was developed and approved by the Ministry of Health does have the 4 registration pathways that somebody can become eligible under. And this is very common for regulatory bodies to have different pathways where people can become licensed, because not everybody has the exact same scenario. But once someone is registered, then they are held accountable for safe, quality, and ethical care. So then it is sort of a level playing field in a way where everyone is held to the same standard for safe, ethical, quality care.
Excellent. Some great questions, some great answers. We've actually run out of time, ladies and gentlemen, and we've hit almost the 7 o'clock mark. So I'd just like to give an opportunity to Trevor and Deborah, if you have any not last words, but closing things that you guys want to say to the PSWs before we end this wonderful webinar.
Thank you, Miranda. I always like to end my conversations in this forum with saying a heartfelt thank you to all of the valued PSWs in Ontario that deliver their care and services each and every day, that stand up and form the fabric of our healthcare system. You are definitely valued members of our healthcare system. So thank you for the work that you do each and every day.
Excellent. Thanks very much, Trevor. Thank you, Trevor and Deborah, and of the HSCPOA behind the scenes, and of course our OPSWA behind the scenes that have been great answering questions. This is always a great opportunity. It's our second webinar today. We've had some great engagement and questions from PSWs. Remember, guys, you can always reach out to HSCPOA directly for answers to your questions. They're very open and they're very willing to work with you. If you're having issues, even registering yourself with them, they're more than happy to step in and work you guys through it. And of course, as well as if you are not a member of the association, we invite you to become a member. Remember, all membership is tax deductible. And if you're not a member of OPSWA, that means you don't have the insurance. And therefore, that makes me nervous because that means you're not fully protected. So, thank you all for joining us. I hope you guys all have an absolutely wonderful evening. And with that, I guess we're going to say OPSWA and HSCPOA out. Take care, everyone.